So sexually transmitted infections, or STIs, are infections that are spread from sexual intercourse. And we usually think about three different categories. So we have bacterial STIs. So that would be chlamydia, gonorrhea, mycoplasma genitalium, and then syphilis. And then we would think about our viral STIs, so HPV, or human papilloma virus, which can cause genital warts and also cervical cancer. Think about genital herpes, and then we think about the blood-borne viruses, so HIV and hepatitis B and C. And then we have our parasitic STIs, and they could be pubic lice or Trichomonas vaginalis, which causes like a vaginal infection. So we think about those ones as how we would categorize it. Now, it's very difficult to say which the most common is in Tanzania, and that's because we don't have widespread accurate tests for some of the most common sexually transmitted infections here in Tanzania. But globally, we would say that HPV, human papilloma virus, is probably the number one. But your body often clears that virus on its own, and now there's a really good vaccine against it. And then we would think probably herpes simplex virus, so genital herpes is probably the next most common. And then finally, we would think about chlamydia, which is one of our bacterial STIs, sexually transmitted infections. And it usually goes in that order of how common they are. So it can be really difficult to know you've got an STI because lots of STIs have no symptoms, so they're what's called asymptomatic. So chlamydia can be asymptomatic, and so you could have HIV and not know that you've got it, or you could have herpes virus and not know you've got it, and the same with HPV virus. So if you were to get symptoms, the most common symptoms would be a change in discharge. So that would be a change in discharge from the penis or a change in discharge from the vagina. And that could represent one of the bacterial infections most commonly. And then we think about having irregular vaginal bleeding, so bleeding after sex or bleeding in between your periods. We would then also think about any pain in somebody's testicles or pain when they're passing urine, and that could be for men or women. And then lower abdominal pain in a female as well. Any kind of lumps or bumps or ulcers are often representative of sexually transmitted infections. And then when we're thinking about things that affect our whole body, we're thinking about the HIV or syphilis. We may be getting a rash over our body, a flu-like illness, or swollen lymph nodes, often in the groin area. But they could be all over. So it depends what kind of sexually transmitted infection you're thinking about when you're thinking about what symptoms you're getting. These are the symptoms usually associated with STIs, yes. But as I say, chlamydia, for example, very often has no symptoms whatsoever. But also you may sometimes get a change in discharge. For example, women, as we know, you get a change in discharge all the time. And that could be completely normal in relation to your menstrual cycle. It could be because you are pregnant, your discharge changes, or it could be that you've got a non-sexually transmitted infection. So for example, a candida infection, which is like a fungal infection, or a bacterial vaginosis infection, which is where the normal flora, so the normal bacteria in your vagina changes, and then you get a change in your discharge. So sometimes it's not an STI, sometimes it's just normal changes. Sure, so it depends what kind of STI you've got. So usually if you come and see a doctor, we'll do a physical examination. So we'll take a history from you, we'll do a physical examination. So in a male, we may want to look at the penis and the testicles, and in a female, we want to examine the external genitalia and also to put a speculum inside to have a look at the cervix, so the neck of the womb and inside the vagina. And then we'd think about laboratory tests. So we could be doing some swabs, so we can swab for chlamydia or gonorrhea, or we could do a urine sample in men for those things. And we have viral swabs as well. And then if we needed to diagnose HIV or syphilis or hepatitis, then it would be a blood test that we would take. So usually it's a combination of these things. So STIs can have really bad effects long term. So if we're thinking about things like chlamydia, what can happen is that can cause pelvic inflammatory disease. So it can spread up into your pelvis and cause problems with your fallopian tubes and your ovaries. And it can cause those to become blocked. So because they can get scarring inside. And then what can happen is that can mean that you have real difficulties conceiving. So it can make you infertile because your tubes can become blocked. It's also a risk factor for having an ectopic pregnancy. So that's a pregnancy that can't get to the uterus. So it gets in one of the tubes and you have a pregnancy there, and that can be really dangerous. You can also end up having chronic pelvic pain from having PID. So because the scarring all inside your pelvis everything's stuck together, so it becomes very painful. There's a lot of psychological issues. So once somebody's had a sexually transmitted infection, they can feel a lot of shame and anxiety surrounding having the STI. So for all of these reasons, we need to sort of try and lower the stigma and make sure that people are coming and getting tested early. Because a lot of these STIs, if we test and treat very early, we can prevent any of the long-term complications. I think we just reinforce that everything's very confidential. So when a patient comes in to talk to me, I'd always speak to them about confidentiality. So I wouldn't speak about their case with anybody else outside of that hospital room unless I needed a second opinion from a colleague, and then I'd seek consent from the patient. So they can know that they can trust us to come in and talk about it. I think also we just normalise STI testing, so everybody who comes in who's pregnant, for example, now gets an HIV and syphilis test, and that's completely normal, and that's to make sure that the infections can't be passed on to the baby, that we can prevent the infections being passed on, because that's one of the other complications which I forgot to say is that if you're pregnant with an STI, there can be a lot of complications. So you could have a miscarriage, so you could lose the baby, you could go into labour early. There could, even with syphilis, you can have fetal malformation, so that the baby doesn't develop properly, and they can have many problems. Also, if you have active herpes when you're delivering a baby, there could be lots of complications. So it's really important that we make sure that pregnant women are screened.